Hey, morning. Yes, yes, I'm just getting in now. Okay. Yes, herbs and spices already here. Thanks so much for coming earlier on the platform. Today is a Monday, and being a Monday, here it is 4:30. 4:30 on my East African time. Not 4:30, it's 4:17. I think I've come earlier for preparation, which is better. And we are changing the course now. Today, we want to bring another good topic, another nice topic that will make people be interested in. But I'll just introduce because medical things are so big, there are so much. Welcome everyone to the platform. Rogers is here. Rogers, my friend. Rogers, you you have something that I really need to talk about, and this thing has been disturbing you, but I know it can be reversed. When we were with you, I noticed and uh, when I was with you, I noticed, and I'm still thinking about it. So don't worry, my friend. I'm going to work on something. I'm going to work on something because I know you need to have some reprieve. I noticed. I will not say it here, but I know you know what I'm saying. Bubbly Beth is here, Jamaican uncle. 917. It's morning where you are. Thank you so much. Herbs and Spice, thank you so much showing us around London. I even saw there is a Uber, a boat that is an Uber in London. Just imagine, when we interact and we socialize, you get to know so many things. And I said, YouTube is a platform whereby you give therapy to yourself as you're creating content and as you are doing your thing and you feel nice. Stress levels reduce and we increase serotonin levels up in your brains. Now, today we are introducing another topic. Um, Today we are introducing another good topic about blood complications. People say blood complications, and when you talk about blood complications in medicine, we call them cardiovascular complications. Some people say heart complications. Now, all these problems that you talk about, all these problems that you talk about, blood complications, heart complications, capillaries, vein complications, they are always brought up by some things, some symptoms. When you wanna know there is something wrong with your body. The symptom is the one which shows you, hey, you have a problem here. Like symptoms like headaches, symptoms like feeling the heart beating faster. Oh, you see, those are the symptoms that we check on and we say you have a problem somewhere. So, cardiovascular complications are complications that are out walking, so can't say hi individually today. So, say hi to all. Yes, Bubbly Beth is saying hi to all because she can't type, so she's walking. Now, if you are coming in right now, say just give a like. Give a like. When you give a like, it makes us feel good. Rogers Killer, boom. Rogers Gilia. Rogers, people are confused on how to call you. Do they call you Kilia or Killer? Because Uncle calls you Robert Rogers Killer. And some people call you Rogers Killer. Please tell us how we can be calling you Killer, Kilia, or Killer. Eh? You see, yeah, Rogers is a very nice guy. He is a guy that unites people, and is oops, Dan. Oh no, it's okay, bubbly Beth. I know how he called me always, Uncle. Yes, Uncle calls you Robert Killer. Now, there are some, when you have problems, I'm introducing what is cardiovascular. Cardiovascular is the bloodstream, the vessels that hold the bloodstream from the heart to the capillaries. Let's say from the heart, the blood vessels that are arteries and veins, and then we go to the capillaries. So I'm going to introduce some complications today that makes a person know that my cardiovascular system, my heart, my blood vessels, my let me name some of the cardiovascular of the those people that have hypertension, those people that have chronic headaches. Today, you will learn of how and why you have headaches, and why sometimes your body is always fatigued, why sometimes your body is always weak, and why sometimes you feel like doing something but your BPs are so high always. Now, the parts of the cardiovascular systems that I'm naming. Before we go to complications, we should know some things that makes our BPs go high or some BPs go down. Now, the heart is the main pump. The heart is the main pump. The heart itself is the main pump of blood. The heart is a muscular organ that pumps blood throughout the body. It has some parts of the heart we're gonna learn. It has got some parts of the heart, the valves, the conducting system, and then we have the blood vessels. This is cardiovascular system is the blood system circulation in your body. Yeah, is the blood system circulation in your body. But the first main organ we know it is the heart. Without the heart, the blood cannot circulate. And then we have the other one which is called blood vessels. Blood vessels are what? Blood vessels are the arteries, the arterioles, the capillaries, the veins, the venules. Those ones that carry blood and circulate through your body are the venules. And then we have the blood. The blood. If you have never known, in medicine we call the blood a tissue. It is just like a tissue like any other because it carries nutrients. Yes. Dr. Ben, I feel like I need to book a flight and come see you in Kenya. I need herbs and spice. A very charming lady. Sometimes she smiles and then you feel life coming up again. Yes, herbs and spice. One day you'll meet me. I'm a very easygoing and simple guy. Ask Jamaican uncle. And Jamaican uncle was surprised the first day he met me. Yes, yes. What that dream will come. That dream will come very soon. Very soon. Thank you so much. And then we have the blood itself. The blood which carries the waste and the oxygen, carbon dioxide, nutrients, and hormones. It is the blood. And the blood contains so many things. If I start naming things that your blood has, you will be surprised. Please put your email address for me, Dr. Benjamin. Uncle, you have my email address. This is it. benjaokwesh at yahoo.com. If I start naming, uncle, that is it. I've posted. That is it. If I start naming what your blood carries, what you have inside your body, you will be surprised how many things your blood carries. Yes, oxygen, red blood cells, white blood cells. You have many more white blood cells. You have more than 7 types of white blood cells. You get it? Do I use this email to book my mod? And Bubbly, come on. Yes, you can use the email address. Do I use this email to book my mod and oil change? Hey, you guys, you make me feel nice at times. Yes. And then we have, yes, I'm saying we have more than 7 types of white blood cells. We have platelets, we have plasma, fluid media carrying nutrients, hormones, and waste. Remember, your blood even carries the hormones. We have just been talking about hormones. Now, we have circuits of cardiovascular system. Circuits, like just like the circuits in your house, the electric circuits, how they interchange. Now your body has your body has yes, 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 yes. Anaweza kuja lini? Saa 11. Um, let we meet tomorrow. I'm online doing something. Let me acha nikupigie after finishing this session, please. Yes. Now, now, I was talking. I'm watching you closely, Beth. Now, let me tell you something. A funny thing. Just as the circuits of electric circuits, how they interchange, your body has circuits. Your blood should be, Hmm? Probably Beth, for real. The amount of things I learned from Doctor, I never had, and it's from my doctor. Yes, yes. Now learn and share, please. Share to someone herbs and spice. Same herb, a lot of time. I do. Yes, yes. Very. You see, same here, babe. I learn more on this channel than I do from my doctor. Yes, now I'm a doctor of many, many people, and I love it when I'm helping people and get enlightened. Now we continue. We continue. I've said there is something called uh, pulmonary circulation. Pulmonary circulation, these are circuits of cardiovascular system. Pulmonary circulation is whereby the blood flows from the heart, it goes to the lungs, and from the lungs, it goes to the heart. You see, from the heart, it goes to the lungs, and then it gets oxygen, and then from the oxygen from the lungs, it goes to the heart again. This is it. It has already got oxygen. I will write your name as my doctor from now on. Thank you so much, Bubbly Beth. Thank you so much, Bubbly Beth. That is pulmonary circulation. Dr. Ben, do you do a telephone consultation? Yes. Very many people have my number. The number that some people, let me post it. Plus, but you should text first. At times you text, and then I can, when I have time, I'll tell you, let's talk at from this time to this time. Plus 254 707 297 36 024. I may not pick if you have not booked, but when you book and then we discuss on text, I can create a session for you, then I help you. You can use that number there to text on WhatsApp and do and book where when we can talk. Now, we have talked about pulmonary circulation, and then we have systemic circulation. Systemic circulation. Now, the system, your body is a system. From the heart, left heart, to the body, to the right heart. You get it? This is called a systemic circulation. The systemic circulation delivers oxygen and nutrients to tissues. This one, now this is how the blood, you see, we have talked about parts of the cardiovascular system, parts of the blood flowing in your system and delivering food to the tissues. Yeah? When you want to go to Uber Eats, or when you want to go to McDonald's, there must be a car or a bicycle or what. So the blood in your body is the vehicle that carries things around the body. Now, you imagine, the blood has come, is there, it needs oxygen. Now, let me swear. So true. Yes, yes. Thanks a lot, Jamaican Uncle. I'm giving it in a layman language. Now, the blood wants to take oxygen to the liver. It will use systemic circulation from the left heart, where from the left part of your heart where the oxygenated blood is. Now the car takes the blood itself, drives up to the body to the right heart, and then it has delivered oxygen and hormones. Hormones in your body are transmitted through blood system, you see. And then we have something called coronary circulation. Even the heart itself needs oxygen. Hmm? Even the heart itself needs oxygen. You cannot say the heart is just a vessel that pumps, and it doesn't get food, oxygen, and nutrients. The muscles of the heart needs oxygen and nutrients. Greetings, Jay Kingre. Thank you so much. Now, the heart has a circulation called coronary circulation, blood supply to the muscle itself. You see, now those are parts of the cardiovascular system, the blood system, how it circulates in your body. We have said the heart, we have said the valves, the conducting systems, all those blood vessels, and then we've said the circuits of cardiovascular system. Now we go back. If we the heart itself is the mother of conducting system, what are the problems? I want to introduce some problems that can make the symptoms to come. But what can make you, what in life can make you know that my blood system or pumping system is not okay? That is where we say symptoms of. If you have a question, please don't just keep quiet. Please, if you have a question, come, let's talk about it. Let's discuss symptoms of cardiovascular system. The symptoms. What can make you know that, no, I think I'm not okay, and I think there is some problem that I'm undergoing through my blood system. Symptoms. I'm just introducing, so that we can know the coming 4 weeks. We will be talking about hypertension, BP issues, blood pressure issues, headaches. It will be a week of headaches, and pressure and pain. Now, the first symptom when you check your body and you know there is a problem with my cardiovascular system, it is chest pain. Chest pain, we call it angina. Chest pain. Let me as I am saying this word, I think it's good to there is someone who said yesterday that I have an accent. I have an accent. I don't know if I have a Luya accent, a Kisii accent, a Kikuyu accent, or which accent. But chest pain, it's also called angina. Chest pain comes when you have cardiovascular problem, blood issues, or the heart issues because of pressure, tightness, and heaviness. You feel your chest when your BP is high or your heart is having a problem. eh? You feel it is having, you feel angina, central chest pain. It is always here when it, and this one is because of a complication that we will see, we will learn. It is called coronary artery disease. Coronary. Anything you see, any word that comes in front of you like coronary, arterial disease, we have said it is the circulation of the heart, the blood circulation in the heart, that gives the heart muscles oxygen. So we call it coronary circulation. So it means your heart is not, the heart muscles are not getting enough oxygen, and that's why there is pressure, tightness, and heaviness. So you get central chest pain. Chest pain is a sign that you really need to see a doctor. You really need to see Dr. Ben. You really need to visit your doctor because it is showing it is coming from the heart. Most of the pain that comes from the lungs don't come centrally, they come sideways because your lungs are more prominent in the back than in the front. You hear me that? I repeat again, most chest pains that come central from your pain, yeah, from your chest centrally, they are from your heart because the lungs are prominent in the back and down here, the apex. So when you have pain on the flanks and in the back, radiating to the back, you know this is lungs that are suffering. But when you know you have pain on the central part of your chest and it is dull and tight chest pain, you know it is you are suffering from heart issues. Hello, Dr. Benjamin, and everyone. Everyone say hi to Gogo. Gogo Daisy is in the house. Say hi, everyone. Now, there is another one called palpitations. I'm going through problems. I'm going through problems that can make you know your cardiovascular system, the blood system circulation in your body has a problem. Palpitations. Palpitations are awareness of irregular and rapid heartbeats. You are not supposed to be aware of your heartbeat. Your heart acts involuntarily. Involuntarily means you cannot control how your heart is beating and you cannot listen to your heart as it is beating. You understand me? So this means that when you hear your heart beating, hmm, it is beating irregularly as is it's not supposed to be beating, and it is beating rapidly. So there are some conditions that bring palpitations, mostly when you have high BPs. This, I'm just going through the symptoms. If you have a question about any symptom that you think about the heart and the please ask. I've always said there is no question that is a stupid question. A question is about enlightenment, and everyone needs to be enlightened, including me. I need to be enlightened on some things. Okay. Heart burn like pain. Sometimes there you feel heartburn here. You feel heartburn. Here, these are chest symptoms saying that your pressure is so high and you need to see a doctor. You see, chest symptoms, those are just chest symptoms that are coming out when you have problems with the cardiovascular system, problems with your body, circulatory system of your blood. And you've seen, we have named several parts of your body that helps in circulation. You see, Maureen, hello host and chat. Maureen Kawila is here. If you want to see a lady who has preserved herself, age plus physical appearance totally inverse. Maureen Kawila, you are blessed. I will not say, but I was in your channel and you said, and I was like, "Hey, Maureen, hey, why do you want us to think you are?" No, you are blessed. Maureen is blessed. Yeah? Or you go to the gym daily. You see, you can be going to the gym and then you feel sweet 16 every day. Now, there is another symptom about the cardiovascular system. About the cardiovascular system. Breathlessness. You feel like You are walking and even the breath is not coming in. When you're coming there, guys, when you're coming in, just give a like. Let's increase more impression on the channel. Let's give more impression by liking the channel. As you are here, let's give the channel some likes. Now, you've had a person walking, and at times this person starts to do breathlessness. This is a sign there is a problem of circulation in your body. And the problem of circulation in your body is not making oxygen to get to your head, to your brain. The purpose of circulation of blood in your body is to deliver two important things. One is nutrients, two is oxygen. Metabolism in every part of your body is done by oxygen. Eh? Thanks, Maureen. Thanks a lot, Maureen, for that. Recognition is good. Maureen, tell people to like the video. Tell these friends of ours to like the video so that we can get more impressions from worldwide. Yes? Now, oxygen is an important thing in your body because every cell that is alive, including my beards, these beards that you are seeing, including my eyes, my skin, including my nails, have been brought because of metabolism, because of oxygen. And the blood circulation is the purpose why oxygen is delivered to any tissue. So, breathlessness, when you're having breathlessness and you can't breathe well during activity, dyspnea, we call it dyspnea. You are doing something and you're having breathlessness. You should know the circulatory system somewhere has a problem. The blood is not circulating well. This is an introduction, guys. We have said this, the next 4 weeks, we are dealing with good living, not having hypertension, not having low blood pressure, not having low blood pressure. We are living healthy. Yes, we don't want diseases. We want to live healthy, and that is what we are doing this week. Heartburn, like we have gone out of chest symptoms. Now we are on breathlessness. Orthopnea. Orthopnea means difficulty breathing when you are lying flat. When you are lying flat, you can't breathe. Sometimes it's hard. It means some part of your heart has expanded or the lung system has expanded and is Lipenga. Wow. Hi, welcome, Efasi. Welcome to the channel. We are talking about cardiovascular system, complications of the blood circulatory system. It means now we are at orthopnea. Orthopnea is a word. Let me post that word. Some people like learning, and when I'm posting some word, they are going deep into their phones. They are learning. They are, yes. Let me paste it here. Orthopnea. Big up Jamaican uncle, learn here thanks to Doc. Yes, yes. And you see, when you are lying flat and you are not breathing, it means there is something within you that is making the circulatory system not, we will see. So that is the problem. And then we have paroxysmal nocturnal dyspnea, sudden breathlessness at night. You are sleeping, and suddenly you stop breathing. Yeah. Hello, Benjamin. Dorothy K. Hi, I'm fine. I'm very fine. Thank you for coming here today. Let's learn and give me some insights. If you have something that has ever happened to you because of the circulatory system, heart complication, or blood problems, and you used a way to make yourself live happily, please share the insight. Share the insight. You see, it is nice to share the insights. Okay. Fatigue, being tired always. Even when you are doing something small, you feel your body is so tired. It shows you have low oxygen levels in your tissues. and the low oxygen levels in your tissues is making your body be tired every time. Hmm? You cannot work as per needed. Fatigue. Fatigue is another complication. Swelling. Now, this one is a prominent thing when it comes to people. Swellings. Have you ever seen a person whose feet is always swollen and this person is always tired? Eh? Especially in the ankles, feet, and abdomen. Sometimes you may feel this person is always sick and the abdomen is so big and think it is the colon or we have just talked about abdominal complications and lifestyle. You may feel this person is normal because this person likes to eat a lot and the abdomen is big, but you will feel you will see the legs are swollen and the abdomen is big. That one is not being swollen. It is called ascites. It is a complication. We will talk about ascites. Have experienced shortness of breath and fatigue. Kingray has experienced shortness of breath and fatigue. Is it random Kingray or is it always Judy? Judy. Kingray is called Judy. Judy, is it always random or do you receive it every time? I need to know that. The swelling of your feet is a sign that circulation has a problem from the heart or somewhere between your veins, and women that are pregnant experience this a lot. And something called DVT, deep venous thrombosis. They really experience this a lot, and it's really a problem at times. You get it? So, there is another symptom, and it is called dizziness and syncope. Sometimes you feel dizzy and you lose breath, and then after some time you come back to normal and you continue. Feeling faint or passing out may indicate arrhythmias or low cardiac output. It means your heart is having a low cardiac output. It is pumping blood so slow, so slow. Hmm? And you see, these are the complications that the symptoms that we are facing every time. Yeah, these ones are heart related symptoms. When your heart has a problem, what do you feel? Chest symptoms like pain, palpitations, and heartburn like. And then we have breathlessness. Yeah, breathlessness, we have fatigue, we have swellings, we have dizziness or syncope. Check that out. These are the prominent things when it comes to heart related symptoms. And then we have blood vessel related symptoms. The blood vessels. The blood vessels, we are talking about the veins. The not every time it was a result of too much fluids around the heart. Yes, it is called pericardial effusion. We are coming, that topic is coming, Judy. Pericardial effusion, that topic is coming, but we will know how to manage it and know what things to do not to get fluids around your heart. It is a very bad thing. You will it sometimes you get chest pain, sometimes dizziness, but let's just introduce the topic, that then the day that topic will come, people will learn. Blood vessels related symptoms like peripheral vascular disease, pain in your legs when walking, cold or pain, your hands are always cold, your feet is always cold, yeah? Your slow healing wounds on the legs, yeah? Jamaican uncle. Dorothy is saying we are in the doctor's hands. No, we are in God's hands. God, my friend Margaret in Norway. I see you and I smile because you always smile. I'm fine, Margaret in Norway, Maggie. We are introducing cardiovascular diseases today, and we are introducing the symptoms. Now, Margaret in Norway, we will start calling you Maggie from today. That's a nice name, Maggie. Now, when you have pain in your legs while walking, cold or pale extremities, and slow healing wounds on the legs. It means blood is not circulating well. Your blood vessels like veins and arteries, they are having a problem. Hmm? You get it? Hypertension, high blood pressure. When I'm saying hypertension, I'm meaning high blood pressure. Eh? Often silent but may cause hypertension, may cause headaches, it may cause nose bleeding. Those people that like nose, they often they are nose bleeding. Hmm? Please, people, share your channels. If there is someone who can share people's channels here, please do share the channels. People will follow and you'll get more subs. Yes, blurred vision. Sometimes you feel you're not seeing well. Your vision has gone. Hmm? Hypotension, low blood pressure. Low blood pressure, sometimes you feel dizziness or fainting, weakness in your body, fatigue, confusion. There are some people when they have low blood pressure, you ask them what is your name, this person will tell you someone's other name, because now the circulation, the brain is not getting enough oxygen. You get it? So confusion is there. Hmm? My friends, you see symptoms of, we have started with the heart. The symptoms of the heart problem, we have said chest pain, breathlessness, fatigue, limb swelling. These ones are related to the heart. You see, dizziness and syncope, feeling dizzy. And then we have gone to blood vessels, the veins and the arteries and the capillaries, the venules and the arterioles. If you have a problem in your veins and the arteries, peripheral vascular diseases may come. You may feel pain in your legs while walking, cold extremities, the hands and the feet, feeling cold always. Slow healing wounds. Your wounds would heal well because your wounds heal well when oxygen is circulating and the tissues are healthy. So if you are not getting good circulation where there is a wound, it won't heal well. Hmm? We have hypertension, high blood pressure, bringing headaches, nose bleeding, and the blurred vision when your pressures are high. And then we have hypotension, low blood pressure. Low blood pressure is, you feel dizziness, your body is weak and confused because now the oxygen perfusion in your brain is not there as per needed. You get it? Yes. If you have a question, my guys, my friends, everywhere, wherever you are in the world, ask. Let's share the, some people fear asking questions. They think some people will feel that they are not okay, no, or they are stupid. No, asking a question is enlightenment, and the person who is asking a question is helping even the one who is keeping quiet, because that question might be eating that person who has kept quiet. So never say that I cannot ask a question. Ask as we continue. Let's enlighten everyone. Now, circulatory system symptoms. Circulatory system symptoms means the symptoms that are appearing when your blood is not circulating well, it is slow or stopped circulation. I want to throw some parts of my body out because my veins, ribs are just breaking. Twatch, twatch. Listen to that. Listen to that. I want to throw some parts of my body out because my veins and ribs are just breaking. Twatch, twatch. Dorothy, do you go to the gym? Do you do some exercise? Are you under any medication that you are taking? Eh? Is knee pain also associated with heart problem? No. Knee pain may be associated with rheumatism. Rheumatism, whereby we have some complication like arthritis, we have complications like juvenile arthritis, we have complications like osteoarthritis, we have complications like systemic lupus erythematosus, that is SLE, lupus. We have complications like gout, arthritis. Those are things that you may get with knee pain. Or we have complications like falling, trauma. You hit somewhere sometimes ago and then you got a permanent problem. You get it? What of loss of collagen or reduced bone density? Uh, Kish Kish, what is your question? Loss of collagen or reduced bone density. That one, collagen and reduced bone density is brought by a condition called osteogenic imperfecta, whereby your bone density is low and you start having problems by cracking your bones every time. Yes, kish kish, yeah, that one can be a problem. That is very nice. Knee pain can be cause of uh, collagen or reduced bone density, because when your bone density is reduced, what can happen is the tension of the the tendons reduces. So the patella bone, you know, I like drawing and explaining. Please let me draw and explain as I answer that question. The question, the patella bone. This is the bone, the bone itself. Uh, Guys, I'm drawing. I'm drawing. I'm drawing. I'm drawing. I'm drawing. I want to answer a question that someone has just asked me. Someone has asked what about the bone and yes. Now this is your leg. This is your leg here. This is your leg. The knee. The knee. I've just drawn the knee. I want to show you. Hope everyone will understand what I've drawn. This is the bone, and then we have here. This is your knee. This bone here, the above one, is called the, no, we start by down, tibia and fibula. And then this bone here, the one that you touch on your knee, is called the patella. And this one is the tendon. This one, the tendon. The above one is the tendon. You get it? So we have the femur here, the bone, the thigh bone. The femur, the thigh bone here. So when you have problem in low collagen density and bone, the tendon, this one, the tendons, they lose the tightness. And then the patella shifts and goes somewhere. It starts to lie on something. So you start feeling pain. You start feeling pain on your knee. So that is kish kish, that is right. That is very right that you are saying. We were on now Dorothy asked me a question. Uh, I want to throw my some of my body out because my veins, ribs are just breaking. Twatch, twatch, twatch. I've asked Dorothy if you are on any other drug. If it is okay, you can share. If it's not okay, we can talk privately. It's okay. Okay. Now, there is some issues that we need to talk. We have talked about cold extremities, cyanosis. When you find your eyes, your arms, your hands are becoming bluish, and the time they are becoming bluish, you are always weak. The time they are becoming bluish, you are always weak. That is one is called cyanosis. It is low oxygen. It is low oxygen. Cold extremities means poor blood flow and sweating, nausea, or anxiety. You are always sweating or anxious, or feeling nauseated every time. You will find it can accompany heart attacks. It means you have low oxygen levels in your blood, circulatory system problems. The circulation of oxygen in your body is not okay. And then rapid breathing, compensating poor oxygen circulation. Wow, Mercy Grace. Thanks a lot, Maxi Grace. Thanks for coming in. We are talking of issues concerning cardiovascular system, issues concerning blood circulation in your system. Now, when you are breathing so fast, it is called Kussmaul breathing. It means the brain is telling your it means the brain is telling your body, let you breathe so fast, let you breathe so fast, so that more oxygen can go. You know, when you are breathing fast, oxygen is going to the lungs and out, lungs and out, lungs faster, faster, inside and out of the lungs, inside and outside of the lungs, faster, faster, so that it can grab oxygen faster and take it to the lungs, because the carrying capacity of oxygen in your blood is low. So it needs to go faster so that it can pick oxygen every time, every time, every time. Maybe you have anemia. The red blood cells are low. So you need to breathe so that those ones that are there can help the brain breathing faster. Now, red flag symptoms. There are some symptoms that are red flags. There are some symptoms that are red flags. They are bad symptoms. And as we talk about this, tomorrow we are starting topic by topic. Hey, Dorothy, good to see you, Dorothy. Mercy Grace has told you. If you have a topic of hypertension, blood related condition, this is the time. You can tell me, Doc, tomorrow let's start by this topic because it's a topic of cardiovascular, blood relation related issues. Someone requested we start by rheumatic heart disease. Rheumatic heart disease, I think I will consider it. But if you think there is a topic you really need us to start with, post. Let me know. It's another session. We have talked about the abdomen, and now we want to talk about the heart. The heart matters, eh? Not emotion matters. When some people hear about heart matters, they think matters concerning emotions, matters concerning relationships. No, this is cardiovascular, matters concerning your survival, how the blood is circulating in your body. Yes, you know there are some symptoms. When you see them, you should know there is a problem, and this problem should be taken care of. Red flag. I learned so much today, Doc. I said thanks a lot, Maureen. There are some symptoms that are red flags when it comes to hypertension and blood pressure. You know, when people get to 30s and above, issues starts to occur of high blood pressure. And I've seen nowadays even younger children of 20s, 25, 23, 24, they are having high blood pressure, which means we are not taking care of medical issues better. So we should check ourselves. We want to learn how to take away these issues. Red blood symptoms are like severe chest pain radiating to the arm, neck, and jaw. Have you ever seen or back someone always complaining of here when pressures are high? We will know why. When you see a person, blood pressure and kidney disease connection, yes, they are connected, and we will learn why they are connected. So I've said today I'm just introducing the topic. So tomorrow, before we start, we will need to know how the kidney works and how the heart works. So that when we are learning how the kidney and the heart works, we will connect. So old people like me, like you, Maureen, you make me laugh every time. You are not an old person. Life has just started. Stop saying you are an old. You are a young, beautiful lady. You, Maureen, you are a young, beautiful lady. Stop that. Now, when you hear a person saying he has neck pain radiating to the flank, just know the blood pressure is high. The blood pressures are so high. Shortness of breath at rest. You are seated down and you can't breathe well. Check the blood pressure. This is a red sign. The blood pressures are so high. Syncope, fainting with chest pain and palpitation. Chest pain and palpitation. You are fainting with chest pain and palpitation. Boo, boo, boo. You feel, you hear someone saying, I'm hearing my heart beating fast, I'm hearing my heart beating fast, and then this person faints. Find an emergency unit. Find a hospital where there is a doctor, physician. We may lose this person. Sudden weakness or numbness could indicate stroke. Getting a stroke or is the first thing. When you feel you are dizzy and there is sudden weakness, I have to go and see my doctor. Eh? Yes, Maggie, Maggie. You have to go and see your doctor. Why? Am I saying something that is hitting you hard? Please just text me. I can advise. But you see, today I'm just introducing. These are symptoms. But we will learn how to stay away from a doctor. Someone said an apple a day makes us to stay from Dr. Benjamin a man. Pressure in my neck. Pressure in your neck. Oh, there are so many things that can make you have pressure in your neck. So that's one thing. Let it not confuse you to be having pressure, hypertension, my lady. You know, if you call someone my lady in England and those other countries, like I think England, my lady means a respected one, a respected person. Hmm? Of course, you see, when you go and greet a person who is respected, and then you address this person, she calls you, and then you say, yes, my lady, at your service. It is a respected word. So, Margaret, my lady, don't worry, you will be fine. We will just talk. So don't be worried when you are getting one symptom that you get. Maybe it's just a transient symptom. So don't be worried. Everything will be okay. That's why we are talking. My lady, we are talking. Yes. So don't be worried. Let's continue learning, and I will teach you how to stay away from hypertensive diseases or diseases concerning cardiovascular issues. And then we learn and we go on with our healthy lives and stay away from Dr. Ben's office every time. An apple a day makes you stay away from a doctor. Yes, but you see, you cannot stay away from Dr. Ben. You need to laugh a bit. Sudden weakness or numbness. I was on numbness. Now, numbness is um, when you feel, when you lie on your arm, you deprive this area some oxygen, so you feel some tinkling sensation. That is called numbness. We call it paresthesia because of nerves that are not passing. So you see, it is important when you hear some issues like those ones and you are just okay seated and go to a doctor, you may be getting, those are indications of some stroke. Okay, let me read this one. Benjamin, sometimes back I experience restlessness, headache, raised heartbeat, and some pressure and pain on the left side of my neck, only to realize my pressure was elevated. I was pregnant. Yes, yes, Maureen was pregnant. And congratulations for being pregnant at that time. Those are signs of pregnancy and high blood pressure, because when you are pregnant, progesterone is rising, estrogen is becoming down, and they happen at the first trimester. They happen mostly at the first trimester, the 3 months of pregnancy, the first 3 months. That is when you get these signs. So, Maureen, don't worry. Those were issues when you are pregnant, but they won't come again. Which kind of foods and fruit should one eat to repair the damaged coronary system? Dorothy has asked. Dorothy, we are going to learn all the foods and things to do. Today is an introduction. I'm just giving them. There are so many fruits, there are so many things you can do to help. So let's go step by step and learn. It is the first day of coronary, and we will learn more as we continue. You know, we suffer from symptoms, and then we are confused on what to do. So I'm bringing out the symptoms, and you see some people here say they are facing some symptoms that I'm naming. So those are the symptoms that uh, we get when there is a problem with our cardiovascular system. When I'm talking about cardiovascular, I'm saying the blood circulatory system and the blood circulatory system, the heart, the coronary system. Yes, there are some signs that are not good signs. Heart murmurs, abdominal heart sound detected by a doctor. Yes, it disappeared, though I kept on checking. Yes, they disappear. After you've conceived, they disappear and you become well. So don't worry, my lady Maureen Kawila. Don't worry. Just continue doing more exercise and being okay. There is arrhythmias whereby Dorothy, atakuja nitamwona kesho. Arrhythmias, and these arrhythmias are uh, just a minute. I was talking to someone who is requesting for something. Someone who is requesting to see me now. And now I can't see anyone who is not having an emergency because I'm taking care of my people here. So if there is no emergency today, let them keep away. Let me take care of you guys. Let's discuss. Now, there is arrhythmias. Arrhythmias are heart murmurs. Sometimes your heart may murmur, may bring a sound like that. Heart sound comes when you put a stethoscope, a doctor listens to the heart, and you know there is an abdominal valve. Those are now detected by a doctor. And then there is irregular pulse by the patient, arrhythmias. Irregular pulse. Hmm? Yes, yes, Jamaican uncle. If there is no emergency and I'm taking care of my people, why should I go? There are some people there who can do the minor things. Hmm? So let's continue. Let's continue. Uh, Exercise intolerance. When you can't even walk or climb stairs, there are some things that a person can't, when you have blood pressure issues, you can't do. You can't even climb stairs. It is very important to check on a doctor. We call it exertional dyspnea. When you climb a stair, you feel so tired, you can't even go up. It is important you check on a doctor and see how you can be helped. Very important. Cardiovascular symptoms or issues concerning the blood circulatory system, they are important. Why? Because you can lose your feet, you can lose your arm, you can lose a part of your body because there is no oxygen going the same direction that is needed. I've talked about the symptoms, the symptoms, and more. There is Dorothy has asked about nutrition care. We will talk about, Dorothy, nutritional care is a very big subject. It is a big subject and it needs a day. So just keep in mind, I've noted and we will talk about it. Let me introduce some common conditions as we are going to end, some common conditions that someone can have that can bring problems to your body to make you have high BPs or complications of the heart. Atherosclerosis. Eh? Atherosclerosis. Atherosclerosis means your vessels, like veins and arteries, that are not responding to, they are not constricting or dilating. They are tough veins. So the blood cannot move as per needed. They are tough veins. Hmm? This one can affect the coronary arteries and they can make you get stroke. You get it? We will see. There is heart failure. Heart failure. Heart failure, we have two types of heart failure. We will see which two types of heart failure. Heart failure with reduced ejection fraction and heart failure with preserved ejection fraction. The complications are pulmonary edema. The blood vessels from your lungs to your heart, they swell. And then you get cardiogenic shock. Cardiogenic shock means shock that is produced from your heart because the supply is not normal. Hmm? And then we have cardiac arrhythmias. Cardiac arrhythmias. Arrhythmias means your heart is not beating normal. It is either going so fast or it's either going too slow. They are called fibrillations. Tachycardia. Tachycardia is when it is beating so fast. The ventricles of the heart beating so fast, or atrial fibrillation. So fast. Complications. You get deposited air in your blood, in your vessels. And you know, when you get deposited air in your vessels, you can die anytime. Cholesterol deposited on your vessels or clots deposited on your vessels, the arteries and the veins. That is the first mistake, and then it comes to death. Hmm? We go to cerebrovascular complication, stroke. Cerebrovascular complication means the brain is not getting oxygen. Where we get ischemic stroke, or you have trauma, something has hit you and then you are bleeding so much so that you are losing red blood cells. You get transient ischemic attack. Short-term memory loss because oxygen is not there in your brain. Hmm? And then we have something called hypertension complications. Hypertension. Big up, Benjamin. Blessings to your family. Thanks a lot. Thanks a lot, Dorothy. All I just pray for everyone here is you have a healthy life. And that's why we are here talking, and that's why we are here saying that. Share this information. Let's have a bigger platform. Let people come. Let's interact. And as we interact, you share those that have channels. You share your channel so that people know you here. And we grow together, and we have a happy family. If you like growing alone, you have a problem. Growth is imminent. As I grow, you should grow so that we smile together. And I usually tell people, when you have neighbors that are struggling and you have a way these neighbors can be better financially, and you can show them so that they will not be coming to you every time to ask for food or salt. So that when one day you are down, you can go back for assistance from the people you helped. So let's help each other hand. Let's grow together. Hypertension complication. Hypertensive, like the heart, can make you have high blood pressure. Brain stroke can make you have high blood pressure or low blood pressure. The kidney is a very important part when it comes to blood pressure. There is something called the renin-angiotensinogen system. I'll introduce it tomorrow, because most of the things that we are going to talk about when it comes to circulation, the main symptom is high blood pressure. So people will need to know how blood pressure is regulated before we go to the complications. So tomorrow I'll talk about the kidney and how it regulates pressure. And people are not telling me what we start with, but it's okay. I'll choose. Someone already told me rheumatic heart disease. Yes. Ischemic heart disease. When you hear about ischemia, you get to know that ischemia is lack of oxygen, and it can bring something even called pericarditis. The one that Judy here has told us he had fluids, pericarditis, fluids around the pericardial system of the heart, cardiac rupture, papillary muscle dysfunction. All these, we'll talk about them slowly by slowly. I want people to understand their bodies and know what to do when there is a problem, and even what to do to avoid some problems. You see? Yes. Thromboembolic disorder. These are disorders of clotting, embolism, inside the blood vessels forming some clots inside. We will talk about them. These are complications. I've said today I'm just introducing. You see, circulatory system of the body with the heart is a very big topic. Hmm? So we need to go step by step, and I will talk about everything because I know this in a layman language and in a medical language because I serve everyone. And let's help everyone to stay away from the drugs. My aim always, when I'm helping any person everywhere, my aim always is to reduce the amount of drugs that a person is taking and the body itself to have a healthy life. Because sometimes I understand that these bodies were not meant to take drugs. These bodies were meant to function for themselves. The great physician, if you have ever read the Bible well, the great physician is God. And God being the great physician, this great physician who is God programmed our bodies to live in natural way, to survive in food that is natural, the, to survive the body not in artificial ways like taking drugs, using some apparatus to survive. So if there is a way any doctor can make you revive your body not to take drugs and continue well, that is the doctor that is a good doctor. But any doctor who gives you 10 types of drugs to survive, 4, 10, 11, today you go, you are added another drug, tomorrow you go, you are added another dose, please be careful. A diagnosis in the body of a person is important. Diagnosis makes you to be healed and to go on well, not to be added like 20 drugs. No, don't use a lot of drugs to survive. No, unless it is important, we should. It is important, yes. We should survive with less drugs in our bodies. Pulmonary circulation complications, we have talked about them. Pulmonary hypertension, right heart failure, causes like lung diseases, left heart. We have said pulmonary circulation is from the lung to the heart. Now, from the heart to the body, that is systemic. So, when blood comes from your lung to the heart, that is pulmonary. And if there is a problem with the blood vessels that takes blood from the heart, from the lungs to the heart, then back to the heart, you know there is a problem. You see that? You know there is a problem. Infective and inflammatory conditions like infective endocarditis, arthritis, pericarditis, embolism, and heart failure. Arthritis can make you have a problem with the circulation also. So if you are arthritis positive and you have been having high blood pressure, please email me or tell me here we discuss. I'm just asking because everyone is sick and we need Dorothy. Dorothy is saying everyone is sick and we need help. Everyone is sick. Everyone is sick and we need help. Yes. Yes. There are some people who are not physically sick. They are really mentally sick. You may feel that this person is strong and okay, but mentally this person is really sick. So everyone is sick and we need help. We need help to every profession. Every profession. We need to laugh to make our mental health better. We need drugs if you are sick. We need advice when we are taking care of some issues. Hey, our last born is here. Our last born. Where did you go, last born? Cute Jess. Where did you go? Hmm? We missed you, cute Jessie. Our little sister is in the house. You've been gone so long. You've been gone for so long. Yes? Yes. You have said, you have talked about infective inflammatory condition. And then we have metabolic and systemic complications like diabetes. Diabetes can make you have high blood pressure and systemic complications. Obesity. Obesity, big body because of metabolism, people with thyroid complications. People with thyroid complications, chronic kidney diseases. I think it is important tomorrow, please, if you are watching tomorrow at 16:30 East African time, 16:30 East African time, I will introduce how the kidney works, because the kidney is the core unit when it comes to balancing of pressure. It is the core unit when it comes to how the pressure in your body is balanced. It has a system that is called renin-angiotensinogen system. Oh, we had traveled for Eid celebration, but now today we come home. Hope you took some videos so that I can come and watch your traveling and enjoy passively. Cute Jesse. Welcome, welcome back, our little young friend, our last born. Now, tomorrow, you keep it in mind at 16:30, I will introduce how the kidney works so that you will understand the kidney is the one which balances your pressure in your body. Very important. It balances how your body works. You get it? So I've said metabolic and systemic contributions like chronic kidney disease, kidney injury, kidney failure, obesity, and metabolic syndromes. Metabolic syndromes like Cushing syndrome, thyroid dysfunction, diabetes mellitus. Hey, Betty's world is here. Hi, everyone. Hi, Betty. Hi, how is you? Hope you're fine. Hope you today you have found me online. Thanks a lot. Thanks a lot for finding me. Like my video and share. Like the videos and share. And you've seen the topics that I've as I finish, I want to go through everything. But now, if you have a question, you can ask. If you have a question, you can ask. There are some conditions like atherosclerosis and its complication, heart failure, cardiac arrhythmias. Arrhythmias are how the heart beats, fast or slow. Cerebrovascular complications like stroke. Stroke is a very complicated thing. Have you ever been, if you've ever had a stroke and you are okay right now, what you had was called transient ischemic attack. Hypertension, hypertension, ischemic heart disease, thromboembolic disorders of clottings and bleeding disorders. We'll talk about them. Pulmonary circulations problems, circulation from your lungs to your heart. Infective and inflammatory conditions like arthritis, pericarditis, all those. Anything you hear of carditis, ditis, that is inflammation. Yes. And metabolic conditions like obesity and also diabetes, sudden cardiac death. Now, we have talked about some issues that the symptoms, and I will go through them before I leave. Now, anyone with a question, this is your time. I can discuss one, two, three questions before I leave. We have seen the the things that the parts of the cardiovascular system, which are the heart, the valves, the blood vessels that are arterioles, arteries, arterioles. Oh, smile in the city, Dr. Benya. So it's okay. smile in the city. If you are coming in late and you have a question concerning concerning anything like hypertension, what, as we finish, please ask. If you are undergoing, if you are taking the medications, I can explain something. And don't leave without liking the video. Please like the video as we continue. Arteries, arterioles, capillaries, venules, veins, blood as the transporting media. Hmm? Benjamin are selling spanner here. So you are. I don't understand that. Am I selling spanner? You are a mechanic. Cute Jesse, are you a mechanic? Okay. Components of blood. We have talked about them. Circulatory system. We have talked about them. Cute Jesse, are you a mechanic? I would love to know. Now, those are the issues that we have talked about. So, if you've been having these complications, I think we have gone through so many symptoms. And no, I'm a doctor, cute Jesse. I'm a doctor. I don't understand what you are saying. Selling spanner. Please elaborate to me, cute Jesse. Elaborate to me what you mean by you are selling spanner. I'm not a mechanic. I'm a doctor, and that's what I do. Now, okay, we have talked a lot about these things that we have come on. Those people that have blood pressure and low blood pressure, struggling with cholesterol issues, we are from tomorrow, we will know. Yes, Kish Kish, that is my profession. That is my profession, and that's why I'm working in a hospital. You see, right now I've put on the this, you call them magwan, the scrubs. Yes, I mean give us jackets. Oh, cute Jessie says I give her a jacket. That let me give you a jacket. And I've given you a jacket, cute Jessie. That's it. Yes, Kish Kish. We that is my profession. CJ Rehab, welcome, 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 welcome to the platform. So tomorrow we're gonna learn about how the kidney works before we start helping people problem, and even I will introduce how the heart works. The heart works so that we can know how to deal with some issues when they are at hand. I've waited anyone to ask any question, and cute Jessie has asked me if I'm selling spanner. I've told her no. I've given you a jacket. Cute Jessie, you have a jacket. Thank you for the jacket. Very nice, very nice. So anyone with a question? Anyone with a question? Anyone? Kish Kish, today you don't have any question? Yes. Let me see if there is any question. But tomorrow we start embarking on some problems. But before the problems, we will start with knowing the two major things. The two major things. Two major things are explain heart failure. Heart failure is a condition whereby the pumping capacity of the heart is not to the maximum. You get it? It may be low, or and explaining heart failure needs me to explain how the blood, sorry, I need to explain how blood is pumped from the right atrium down to the ventricle. Oh, how much is it I buy also? Okay, some people are asking me for jackets. Okay, let me give you jackets. There you. How someone I'm answering CJ Rehab. How the heart is pumped from the right side of the atrium down to the ventricle, then to the pulmonary circulation, which uses pulmonary vein up to the lungs, then down from the pulmonary circulation to the left atrium, where we have the pumping down to the left ventricle and then back to the outer to the systemic circulation. So that one simply said heart failure is a clinical syndrome where the heart cannot pump blood effectively to meet the body's metabolic demands or does so elevated pressures. So CJ Rehab, heart failure is just a syndrome where the heart cannot pump blood effectively. But I will explain tomorrow. Hope you'll be here at 16:30. I will explain tomorrow how the heart normally pumps blood and then what cannot make the heart to pump blood normally. You get it? So those are things that we will discuss tomorrow. Hope I've answered your question well. And anyone else? CJ had told me to explain heart failure. If you want to know heart failure, you need to know the normal. From the right atrium, from the vena cava, the blood is pumped from the vena cava to the heart, from the vena cava to the right atrium, then down from the valves, the mitral valves, to the ventricles, the right ventricles, then from the right ventricles, it passes through those valves, the pulmonary valves. The pulmonary valves goes up to that vessel goes up to the heart, no, to the lungs. From the lungs, it comes back from the lungs through the pulmonary artery. From the pulmonary artery, it enters to the left atrium, waiting to drop down through the tricuspid valves. So the tricuspid valves goes down to the left ventricle, and then from the left ventricle, it goes to the aortic valves, through to the outer. Now, from the outer is there where blood divides through the systemic circulation, and then there is another vessel there which goes up to the coronary to give the same heart, some circulation of oxygen. And then we have some celiac veins around, you see. But when the heart cannot pump blood and circulate like that, that is when we call it heart failure. Heart failure. And many things can have you to have heart failure, the ones that we have named. Very many things can have you to have heart failure. But there are some conditions whereby you can have heart failure. Heart failure with reduced ejection. You see, the heart has failed, but the ejection is reduced. The blood that is coming out of the heart is less. And then we heart failure with preserved ejection due to this systolic dysfunction. Systolic and diastolic. When the heart is at rest, it is not functioning. Those are things that we're gonna know. Right-sided versus left-sided heart failure. We're gonna talk about them. Very important. There are some things that heart failure can have, like pathophysiology, neurohormonal activity, ventricular remodeling, inflammatory cytokines like tumor necrotic factors. Those are things we learned some times ago. Immunoglobulins, like they are there. You see, heart failure is a big topic. Yes, boss one has come. Boss one, welcome. I was just talking about overviews of heart failure. Common causes of heart failure. These are ischemic heart attack, heart disease. Ischemic heart disease is where oxygen levels are low, and then you get heart failure. Hypertension. But you see, how ischemic? Ischemia is when the heart itself is not receiving enough oxygen. You get it? So, Barbara, welcome to the chat. Welcome to the chat, Barbara. Please don't go without saying hi, giving me a thumb, liking the chat. Hmm? Hypertension explains is one of the symptoms of heart failure. Valvular heart diseases, the ones like we have talked, the coronary vessel getting a problem. You see, cardiomyopathies like dilated, hypertrophic, restrictive. There is something called cardiomyopathies. We're going to talk about them. So many people, all ages, have cardiomyopathy. The dilated, hypertrophic, and restrictive. Those are things we're going to learn. And the clinical features of heart failures, we have talked about them. We have talked about dyspnea, we have talked about fatigue, we have talked about peripheral edema and ascites, we have talked about pulmonary rales, we have talked about jugular venous distension. All those we have talked about them. And the complications when we started, we talked about them. Pulmonary edema, arrhythmias, thromboembolism, multi-organ. We will talk about management. Hmm? Maureen Kawila, connected to you. So now that you are here, I think that one I've explained to the brim. Even I've not explained, I've really talked about it. But tomorrow I'll come with images. Tomorrow I'll come with images so that when I'm saying this is the vena cava, you are seeing this is the vena cava that brings deoxygenated blood. When I'm talking about this is the mitral valve, you know, oh, so this is the valve that makes blood not to go back in the heart. When I'm talking about the pulmonary circulation from the pulmonary valves, from the right ventricle, you are seeing that this is the pulmonary valve. When I'm saying this is the aorta, this is the one that brings to the body oxygenated blood. People are appreciating. It is, we will learn, you are giving us fire for man. Yes, uncle, someone had asked about the heart failure. You know, there are some things in when you say they sound small things like heart failure. People think heart failure is now the heart has stopped working. No, heart failure does not mean the heart has stopped working. It means that it's symptoms that occur showing that there is a problem somewhere. Hmm? Boss one, thank you for sharing those links. And if you are here, you are new, please follow the the links. Share, follow someone, subscribe to someone. Everyone that here has got a platform, and that platform they do so many great things. Like I've been just from watching Herbs and Spice, and she's doing good vlogs, soothing. Hmm? When you are you see, Herbs and Spice says that is what I thought. Heart failure means the heart has stopped and it's not working. No, it's not that one. Now, anyone with the last question, anyone who has a question, a last question, please. Anyone with the last question? Cute Jess, cute Jess, you are laughing at me or at yourself? Hmm? Let's see. Any question? That heart failure question was nice. The heart failure question was so nice. Okay. Okay. Anyone with any other question? We need that so much. That's education we all need to know. Anyone with any question? I want to have a last question before I leave. Any last question before I leave? Any last question? As we talk, any last question before I leave? A person who has been confused on my words, sometimes medical words are so complicated, and when we learn, we need to learn even what they mean. That's why you've noticed when I'm waiting for a last question, please. So you've noticed when I say any medical term, I explain it immediately. If you've noticed, please, if you are watching and you've not liked, please just do a like there as we continue. There is someone I know has a question but is not asking. Yes, anyone with the last question concerning the heart or the blood pressure? Dorothy had asked about the foods we can eat, and nutrition is a big topic concerning what you can eat when you're having a problem. Yes, yes, people are coming in. Please, have when you're coming in, have a like. Just like if you have not subscribed, so that you can get instant notifications. Please like. I'm waiting for the last question. I know someone has a question somewhere. And I've said Dorothy has had asked on the foods we can eat so that we can stay away from this complication. And I said nutrition care is a big topic and it will come as it is on. That is the only question that I've put in pending, because we need to learn first on what is the normal, and then we go to the complication. Can blood pressure control on? Yes, yes, Betis World. Betis World is asking, can blood pressure be controlled on lifestyle changing? Yes, lifestyle with blood pressure, they go hand in hand. It is very important to change your lifestyle when you notice that you are having problems with high blood pressure. Because if you are used to taking high carbs, if you are used to taking alcohol, and then you start having high cholesterol levels in your body, you will start having hypertension. We will learn how hypertension comes because of high cholesterol levels in your body. Stress, maybe you have a factor of high blood pressure in your body, and the lifestyle that you are living is giving you stressful moments. Hmm? If the lifestyle that you are living is giving you stressful moments, you will have high blood pressure. So, yes, Betty, blood pressure can be controlled by changing the lifestyle that you're having. That is very true and important. So, guys, if you are having issues concerning blood pressure because of stress, and you have seen most of the time we talk about mental health. We are talking about lifestyle. Hmm? Sandra, welcome, welcome. Like the video. And this topic on high blood pressure, it's a diverse topic because nowadays even young people have high blood pressure. Long time ago, we were saying high blood pressure is a topic for old people. But nowadays you've seen even young people get high blood pressure. And sometimes you may not get high blood pressure, you may even get low blood pressure. Low blood pressure is a problem of cardiovascular. It's a cardiovascular problem. So please, as we introduce this topic, if you've been suffering from these problems or any of your family members have been suffering, share to him or ask the questions that we can interact, and then you can go talk to your uncle, your relative, your auntie, so that this auntie can be living well. Okay, before I finish, I want to do something that I left pending yesterday. I may not, someone has asked me to talk about it. I may not have time to talk about it. There is something called andropause. 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 Remember about andropause? Andropause. Who remembers about menopause? And someone asked about andropause. Hmm? You remember about andropause? Now let's deal with andropause because the month will be so uh, the month that you are going on, you will be talking about several things about cardiovascular system. So andropause is like menopause to men. Yeah? Andropause. Andropause. You may say that men don't undergo menopause. Hmm? You may say that men don't undergo menopause. Yesterday, someone asked if men undergo menopause. And then someone told me that no, men don't undergo menopause. They undergo like what crisis? Midlife crisis. Please, if you are watching and you have not liked, let's take the number of likes up a bit. Let's talk about andropause. What is andropause? Andropause is the age-related decline in male testosterone level. Usually, yes, midlife crisis. Kish kish. Andropause with midlife crisis are totally different. Midlife crisis is social and character. You would want to do things that you wanted to do when you are young. Andropause, listen to the explanation about andropause. Hmm? Listen to the explanation about andropause. Andropause is the age-related decline in male testosterone levels, usually starting from 40 to 50 years, leading to physical, sexual, and psychological changes. Unlike female menopause, it's gradual rather than abrupt. You get it? Welcome, MaJD. MaJD is here. Now, in women, we saw menopause starts from withering of the follicles of the uterus. But andropause, it is decline in male testosterone levels. When male at some ages, their testosterone level starts to decline. Testosterone is the hormone that makes you a man, the hormone that makes you feel strong in bed, the hormone that makes you have that voice to talk as a man. So if you are a man here and you are heading there and you have started, just know that problem has started. Hmm? Gabriel, Kish Kish, where is Kish Kish? All those men that are here, this is your topic. And please like the channel. Those that have not liked and subscribed, do so. Hmm? How does it come about? How does andropause come about? Physical and pathophysiology. No, testosterone production in male primarily comes from some cells that are called Leydig cells, yeah? From the testes. Normally decline. Dr. Ben, I'm a woman, unfortunate. Oh, Kish Kish is a lady. Sometimes I, I wish I knew people, but I know Kish Kish, you learned a lot about menopause. Sorry about that. I'm sorry, Kish Kish. It's because of, sorry. Now, testosterone production in men is primarily from some cells called Leydig cells in the testes. You get it? Normally decline 1 to 2% after age of 30 to 40. The Leydig cells function goes down, altered hypothalamic pituitary from the brain. It starts from the brain. From the brain, the signaling starts to go down. If this is in men, the signaling starts to go down. It is called hypothalamic pituitary. Kish kish, I was thinking the same way, like even uncle was thinking like that. Connect, hope, visit me soon. Oh, boss one, visit our last born, cute Jessie. Please, cute Jessie is begging you to visit her. Now, I'm saying for men, it is a programmed thing from the brain. The Leydig cell starts to reduce production of the testosterone, the hormone that makes a person to be a man. Eh? And then increased sex hormone binding globulin. And then You start having lots of people think the way. Now, chronic illnesses like obesity and medication can also accelerate decline. People that are diabetic, please, we are so many, 21, and the likes are still 18. Please, let's continue liking. Now, this is andropause. When you get to 35 years as a man, the signaling in your brain that tells the Leydig cells in the testes, please produce testosterone, it goes down. You get it? And then increased sex hormone binding globulin makes the free testosterone to decline. Sex hormone binding globulin, which makes testosterone to come, reduces. There is another thing that is called chronic illnesses and medication can cause decline. Chronic illnesses. This is a secret. My name is actually Keisha. Don't say it out loud. Okay, I will not say it loud. I will not say it loud. You see, some did you see that Jamaican uncle? Okay. Now, when you are having some problems and you're taking some drugs, and you're taking some drugs like antidiabetics, does Viagra help in with andropause? Okay. Keisha, oh, Kish, I've seen that. Kish, I've seen that. Viagra is a sexual enhancement drug, but most of the time I'm answering Smile in the City. Beauty, welcome in the platform. Thanks a lot for being here, my friend. My friend, I see beauty and I feel good. Now, Smile in the City, I want you to understand this. Viagra is not mostly a drug for sexual enhancement. Viagra is a drug used to Viagra is a drug used to enhance the heart that is beating slow to at least beat harder so that blood can circulate in your body. You get it? Yes, Maureen, thank you. We'll meet later. Viagra, but by the time you are taking it, it enhances blood perfusion on the penis. So when it enhances blood perfusion on the penis, you become hard. You get it? Your penis, the penis of a man, when it is hard, it has a lot of blood perfusion. So that's why when you take Viagra and the heart pumps blood so hard, it makes it erect. In other words, when you are using Viagra, you are being helped on sexual enhancement as an adverse effect of that drug. Adverse effect of that drug means this drug is meant for people who have hypertension. This drug is meant for people who their heart beats so slow. But now you are using it because of another problem. You get it? Yes, JC. Welcome, JC. You are using it because of another problem. You get it? It's like those people that use this drug called the antihistamine. There is antihistamine that people use when they don't have appetite. Hmm? It is called, let me find it out. It is called, there are some people when you are using something and you are benefiting from the adverse effect. Just a minute, guys. You see, Smile in the City. Yes, I found it. It's called cyproheptadine B. when you are using cyproheptadine and you want to increase appetite, that thing is called an antihistamine. And the adverse effect is you being hungry. So you eat a lot. So you are using an antihistamine not to treat histamine release or allergic reaction, but you are doing what? You want the adverse effect. So that one is like Viagra. Viagra, people use it in the wrong way. It is used for hypotension, but it gives you the hard penis and then you feel nice. So it cannot help in andropause unless, smile in the city, unless you are on the edge of andropause and the only thing that you want to benefit from is sexual pleasure when you are down. So that one cannot increase testosterone because we have seen the first thing when you are having a problem with andropause is reduced in testosterone level. Smile in the city, are we together? I've explained that so well. I like explaining something until a person gets it. So they are so, yes, welcome, welcome, welcome. Common symptoms in andropause are like low energy or fatigue, reduced sexual drive, libido, erectile dysfunction, because your testosterone is not there, mood changes and irritability and depression, because if you cannot satisfy a woman, you will start being depressed. That one is always there, but even because the testosterone is down, there are some hormones which don't come out normally. You know, it's a mood because we are changing with levels. Loss of muscles, mass, and strength because testosterone gives you a manly body. So when you don't have testosterone and you are not going to the gym, your muscles becomes flaccid. Increased body fat, increased body fat, decreased bone density, and poor concentration and memory. So, what can make you have a reduced uh, testosterone levels? What can make you have reduced testosterone levels? Natural aging, chronic illnesses like diabetes, obesity, and hypertension. And then we have stress, poor sleep, and alcohol use. Poor sleep and alcohol use. Certain medications also like steroids and some methotrexates, they can make you be like that. So when you find out you are having these problems and the doctors have checked the testosterone levels, eh, in the morning when you wake up, the doctors have found that you have low testosterone levels. What you can do is lifestyle change, exercise, reduce the weight. Reduce weight because more cholesterol and fats in your body reduces testosterone levels release, sleep and diet. You get it? Testosterone replacement therapy is the only hope for a man with low testosterone levels. You see, andropause is not a big topic. It only beetroot juice helps. Okay, okay. Kish Kish says beetroot juice helps when it comes to andropause. Kish Kish, beetroot juice helps people to become erect when they have this problem. Maybe you have experience on this, please help us. Maybe it can help other people. Because normally in medicine, we give a therapy of testosterone replacement therapy. But if beetroot, okay, you see now men that are in the house, Kish Kish has told us that beetroot helps in erection. So when you are not even carrot juice, hey, even carrot juice. So if you are not being satisfied or you are not satisfied as a lady, tell your man to take. Yes, Kish Kish has some answers. Tell your man to take some beetroot or carrot juice, and you will do wonders. Yes. So andropause, that is it. And peanut punch. Wow, peanut punch. Kish kish. Today you are really a naturalist. Kish kish is really a naturalist. Barbara's world. Hey, you see, eh? JC008 says Ujipawa. Wow, Ujipawa. Eh, how does it? What does Ujipawa have, JC, inside? I've heard about Ujipawa for so long. Today I'm getting to know and learning so many things. Yes, yes. Even Gabriel Mau has laughed about Ujipawa. Jesse, tell us about Ujipawa. What does Ujipawa have? Okay, we have another doctor in the side house. Yes, we have so many doctors who are helping us. Let me learn. What is Ujipawa? Roger Skiller, I see you. Boom. What is Ujipawa? Ujipawa, smile in the city, is a porridge that is mixed with several things that I don't know. Even me, I'm asking, and it is sold here in Kenya in some outlets, shops. It is called Ujipawa. And I've heard when a man takes Ujipawa, in the evening in the house, it is good. Everything is fine. In the bedroom, everything is fine. That's why I'm asking what Ujipawa contains. Eh? I would really like to know what Ujipawa. Oh, it's a booster. Boss one knows Ujipawa. Very nice. Boss one knows Ujipawa. Let me see here. Let me see here. It's the one. Smile in the city. You are laughing. It is true. Now, thanks a lot for everyone that has been here. Tomorrow, as I've said, we will start with explaining how the kidney and the heart works. The kidney and the heart works. And then we continue with the topic. Today we have had a session that is very long. Imagine 2 hours. 2 hours. Thanks a lot for everyone that has come in. Hmm? Me too. Uncle, when we will be here, we will go and find it. We'll see how Ujipawa is. Now, thanks everyone who has been here. Tomorrow, let's meet on the same session to see about the kidney and how the heart functions so that we can continue our topics. Bye, everyone. Thanks. If you have not shared, please share and like as we continue. Have a lovely evening. Life should go up to 5 hours. Imagine me explaining all these things for 5 hours, boss one. Just imagine. Bye. See you tomorrow. See you tomorrow, guys. We'll talk tomorrow. Bye bye. Yeah, yeah.